So you get a call from a prospective patient, and the first question out of their mouth is, how much do you charge for a crown or an implant or an extraction, whatever it is, service that they're calling about. The dreaded shopper call. Now, funnily enough, most people don't like these calls. They feel like there's something wrong with the person making the call. I'm the exact opposite. I really love shopper calls because it's at least an opportunity for me to convert this person into a long-term patient in the practice. So how do we take this call, this shopper, and turn them into a good patient? Well, that's what I want to talk about in this week's tip. So how do you turn a shopper call into a great patient? Well, it starts off by knowing two things about a shopper. First thing is, they're a person. And I say that because some people have a really bad attitude towards shoppers. They're calling to get a good price on something. And I get it, but let's take a look at something for a minute. Have you ever bought anything because it was on sale or you were getting a discount or some type of a deal on it? Chances are the answer to that question is yes, which also makes you a shopper. We're all shoppers at some point in our life, so there's no reason to cop an attitude about this person because they're looking for a better price on something. That's the first thing to know. The second thing to know is in most cases, a person calling, who's shopping for a price on a particular dental procedure needs more than one of those procedures. And I say this because if they've been diagnosed with a crown in the practice they were in before, chances are they're not going to leave that practice to save a couple $100 on one crown. They probably need more than one crown or more than one implant. So this is an excellent treatment opportunity for your practice. So how do we turn this shopper into a great patient? Well, the first thing is we have to get into communication with this person, and we have to be willing to communicate with this person. You may be the fifth or sixth office that they're calling asking for a price. And if you I've listened to a ton of mystery calls. In a lot of cases, when people call an office asking for a price, they're told we don't quote prices over the phone and hung up on, or we don't discuss those things. In other words, no one is forthcoming at all. So how are we going to handle this call when it comes in? We're going to be really nice, and they're going to say, well, how much do you charge for a crown? And you can say, listen, I'm happy to answer that question for you. Do you mind if I ask you a few questions first? 90% of the time, people are totally happy to do that. Sure, you can ask me some questions. Of course, you're going to get some weird ones. No, you just need to give me the price. In which case, guess what? You're not going to convert those, and that's okay. There's lots of people like that in the world, and unfortunately, that might be one of those. But in most cases, they'll be happy to answer your questions first. You say, great. Okay, well, first off, what's your name and phone number in case we get disconnected? Now, you might go, well, I have caller ID. Why do I need that? Well, how do you know that that's that person's phone? They could be using their friend's phone or their spouse's phone. Let's find out who this person is. Let's actually establish a rapport. You've already introduced yourself, hopefully, when you answered the phone. I'm Jeff. So now find out who this person is. This is Bill. Okay, great, Bill. So here, I have a few questions for you. So first off, where did you get the idea that you need a crown? Because Bill could have been going to WebMD and saw that he chipped a tooth and he needs a crown. So WebMD told him he needs a crown, and probably also that he has cancer, because that's what WebMD does. Or Bill has gone to a dentist, which is what's going to be the case most of the time, and has been told that he needs a crown. So then we're going to ask Bill, okay, good, where in your mouth do you need a crown? And how many crowns do you need? Well, the doctor said I need 4, and also 2 root canals. Okay, well, where in your mouth are these teeth? Well, because they're not going to know, upper left, lower left. On the left side of my face, is it the top or the bottom? Okay, yeah, it's the top. Okay, good. So you identify where all these problems are that Bill is having. Okay, then you might ask something along the lines of, are they sensitive to hot or cold? When you drink coffee or you drink something cold, do you have any sensitivity? How long does the sensitivity last? You're getting more information. You're establishing communication here with Bill. You might ask if Bill is in any type of pain. Is it painful at all? You're basically trying to find out, here's a person, they're calling for a price on something, they want to get a procedure done. What's going on with you, Bill? Meanwhile, you've got your new patient intake form that you're filling out, okay, as you're going. He may or may not schedule, but you're getting the basic data. Now comes the $1 million question, or the $1 million exchange. You say, listen, Bill, here's the thing. I'm not the doctor, so I can't tell you whether you need a crown or not. And different doctors look at things different ways. And even if you were talking to our doctor on the phone, our doctor would not tell you whether you need a crown or not, because he or she has to see you. So what I'd like to do, we offer a free consultation, like a second opinion type consultation. And this is important. You have to have this established in your practice. There should be a specific place your receptionist or whoever is handling these new patient calls can route this type of traffic. It might be a free consultation. It might be a $29 x-ray and consultation, whatever it is, all right? So you tell them, look, we do a free consultation or second opinion, and my first one I have available here is at 3 o'clock today or 4 o'clock tomorrow. Doctor can look at you, look at what's going on, and tell you what he or she thinks you might actually need, because we really don't know what you need until we actually see you. Now, in 90% of the cases, if the call has gone this far, Bill will just schedule at that point because, finally someone actually talked to him as opposed to telling him that we don't quote prices on the phone or whatever. Now, you notice I haven't quoted a price yet, but 90% of the cases, these people will schedule. But you still may get the question, but okay, fine, but how much do you charge for a crown? Okay, fine. Now you give them a range from a stainless steel price all the way up to a crown and build-up. Well, it's anywhere from $700 to $1,600. But again, Bill, we don't know what you need. Okay, and we don't even know what kind of a crown is right for you, if you even need a crown. So let's just get you in here for this free consultation. The doctor can look at you, and we can take it from there. And in a lot of cases, these calls will convert. And then you fill out the rest of your new patient intake form. Any other problems Bill might be having, you might be missing some teeth, anything else Bill wants to talk to the doctor about, what's Bill's insurance if you accept insurance, just so you have the whole thing filled out so Bill is treated like a normal new patient, comes in for his second opinion, and the doctor can then at that point present the appropriate treatment for Bill. The fact that you were willing to communicate with Bill, there was good customer service, you cared enough about Bill to answer Bill's questions, in most cases will get Bill to schedule, and this will turn this person into a decent patient of record. Now, what I'd recommend, if you want to know how your office is actually handling these calls, I'd recommend we offer a service called a mystery call. This is basically what we call your practice as a prospective patient, and the service is free. I'll put a link to it on the description on the video below. You can sign up for it. We'll give you a mystery call, and then we will call your practice afterwards to talk to the doctor and explain what we found. Because in a lot of cases, receptionists are very cool, they're very nice. They just don't have the skill set to properly handle these calls coming in, or they have a bit of a wrong idea about how they should be handled. The other thing is receptionist is a very hot button in the industry because just of the conversion rate of calls coming in and turning them into new patients. So we've got lots of training on reception that we've done. We've got lots of videos on it, but if there's any particular subject about reception that you haven't seen that you'd like to see, put it in the comments and we'll see if we can't put a video tip together for you. Otherwise, folks, I hope this helps. If you want to find out more about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Don't forget, if you want to continue to receive tips like this, to subscribe and click the notification bell so that you're notified when these tips come out. Folks, have a great week, and we'll see you at the next tip.